Hi, my name is Timothy Peach, and I'm here to talk about the Union Square Family Health Clinic, which is a part of the Cambridge Health Alliance in the Boston area. The clinic is located on 5 Middlesex Avenue in Somerville, Massachusetts. The neighborhood that it belongs to is referred to as Winter Hill, and the clinic is located just north of Boston, approximately 5 miles north. Winter Hill has a population of about 25,000 people, with a median age of about 33 years old. The median home value is just north of $350,000, while the median household income is about $55,000. Now I'm going to talk about the demographics of Winter Hill, just so you can get an idea of who's living here. As you can see in this figure, a majority of the people living here, about 62%, are white. There are also populations of Black or African Americans and also Asians, making up about 10 and 9% respectively of the population. Looking at the top figure, you can see that about 1/3 of the population is married, while the majority is single and are either guardians, living with a roommate, or living by themselves. Looking at the bottom figure, the average household size is 3 people, but only 26% of households have children, while the remaining 74% do not have children. The top figure shows that over 60% of housing in Winter Hill is occupied by renters, which is important to note as there have been some changes in the Somerville housing market in recent years that I'll discuss later. And the bottom figure shows that about half of the population works full-time, while part-time workers and unemployed individuals are about 1/4 of the population each. And this last figure shows that, in terms of crime rates, Winter Hill is slightly safer than the national average for cities. Motor vehicle theft is one of the biggest sources of crime in the area, with it being well above the national average, while the other forms of crime listed here are all below the national average. Some notable locations near the clinic are Foss Park and Sylvester Baxter Riverfront Park, which are both within walking distance of the clinic. The clinic is 3 miles away from both the Cambridge Health Alliance, Cambridge Hospital, as well as the Mass General Hospital, which is the largest hospital in the Boston area and is often rated as one of, if not the, top hospitals in Boston. When it comes to transportation, the clinic is located right next to Interstate 93, which is a major highway in Boston, and is also right next to a stop on the Orange subway line, which runs through the city. Another important place of interest is Assembly Row, which is a relatively new development in the city of Somerville, and the clinic is located just outside of this development. Assembly Row is essentially an upscale outdoor mall that has restaurants and various types of stores. This place is important to note because it relates to the ongoing issue in Somerville of, and also for the neighborhood of Winter Hill, of increasing property values and gentrification. In the past few years, rent in Somerville has increased so much that countless families are unable to afford rent, and as a result, they are being evicted from their homes. The article shown on the left discusses recent protests over this issue and even describes the experiences of various Somerville residents, such as Jose Oge and his family, who faced eviction after being told that their rent was going to increase by about 50%. The graphic on the right is from an article in a local newspaper that describes a recent rise in the homeless population in Somerville. There has always been a homeless population in Somerville, which they note that mental illness and addiction are contributors to this, but the homeless population has increased in recent years, and upticks have been noted at the start of the September rent cycle, likely from people being displaced due to being unable to afford rent. Here are some of the policies and ordinances in Somerville. First, being the supervised consumption site that was approved by the city of Somerville and will soon be operational. This site, which will have medical professionals present, would allow for those who use drugs to do so in a safe environment that can help to reduce overdoses and drug-related deaths. Somerville has also passed laws that nobody is allowed to smoke within 50 feet of a public building or healthcare institution, and also they passed regulations that set the age to purchase tobacco or nicotine products to 21 years old. Additionally, the city prohibits any alcohol advertisement on property owned by the city, and all alcohol advertisements must be over 500 feet away from any playground, elementary or secondary school, place of worship, or childcare facility. The Union Square Family Health Clinic operates 8 a.m. to 8 p.m. Monday through Thursday and 9 a.m. to 5 p.m. on Friday, and it's closed on the weekends. The CHA, which is the Cambridge Health Alliance, the organization that the clinic belongs to, has about 100,000 primary care patients, and their areas of service include family medicine, lab and pathology, mental health and substance abuse, nutrition, primary care, sexual and reproductive health, and women's health. According to a case study done on the organization, among all CHA patients, 70% are vulnerable, 57% have public health insurance, 6% are uninsured, 44% are non-native English speakers, and 30% of all care encounters involve a medical interpreter. The CHA also helps uninsured and underinsured individuals to apply for Mass Health, which is the program in Massachusetts that combines both Medicaid and CHIP, which is the Children's Health Insurance Program. According to the same case study, most of the CHA's patients are low income, and over 20% of them struggle with substance abuse and mental health disorders. The CHA is also active in their community as they founded the Somerville Community Health Agenda, which is an ongoing collaboration between themselves, the Somerville Health Department, and the people in the community. In 2017, they published the Well-Being of Somerville report, which addressed the state of the city and how its health needs can be improved. The following year, they held community listening sessions and did surveying to pinpoint health areas that the community felt needed to be addressed or changed. And in 2022, they created the Healthy Somerville 2022 plan, which is a plan outlining initiatives and changes that the CHA is going to make in order to help the community. These initiatives include extending primary care access to thousands of people who previously did not have primary care coverage, building a new care center in the city, converting an emergency department to an urgent care facility, relocating the teen health center to a more convenient location for residents, and launching a new health improvement plan with coordination from the city. Here are some of the ways I believe the clinic can improve their community's health. With the supervised consumption site soon to be open in the city of Somerville, and the clinic already providing care to those with a history of drug abuse or mental illness, I believe that a collaborative effort with this site would be a great benefit to those who are struggling with drug addiction in the community. Additionally, it can prevent possible overdoses or deaths due to drugs. While this is not necessarily a fault of the clinic, I also believe that the clinic can play a part in the ongoing housing crisis by offering resources to its patients, many of whom are low income or non-native English speakers who may be affected by the increase in rent. Many people who are facing eviction are usually not aware of some of the resources available to them, or they just assume that they won't be approved for assistance, so they don't apply. In Massachusetts, state housing assistance programs only reject about 6 to 7% of completed applications, with most of the rejections being those who either did not complete the application or were above the state income limit. There are also nonprofit organizations such as Homestart, which helps prevent hundreds of evictions each year with a 95% success rate for evictions. Another area for improvement is hiring additional staff, particularly front desk staff, which I will elaborate on shortly. Just to recap some of the clinic's strengths, I believe that the CHA assists underserved populations and is very actively involved in their community. Looking at some of the people's experiences online, I found a common complaint among patients was that the CHA had poor customer service. Multiple people left reviews online saying that they had phone waiting times upwards of 30 minutes. some even up to an hour. And these phone calls sometimes resulted in the clinic either not answering the phone and the caller having to call back, or the caller just being hung up on because they weren't ready to answer the clinic when they finally got to them. This issue extends to scheduling appointments as well, which these appointments may actually have to be booked weeks in advance. I believe that the clinic were to hire additional staff, particularly those that could work the front desk, and could improve their customer service, then I believe that people would have a much more positive experience with the clinic. I believe that the clinic's location is very beneficial since it is located near both public transport and a major highway. There are also parks and recreational fields in the area, which can help promote outdoor activities for residents. Lastly, the clinic's work with drug addiction and proximity to the supervised consumption site can allow for them to work collaboratively with the site. As for threats in the community, the ongoing housing crisis is disrupting people's lives and causing an increase in the city's homeless population. Likewise, drug abuse, overdoses, and mental illness are all prominent issues in the community, which hopefully will be somewhat addressed with the changes soon to be implemented in the city of Somerville. Lastly, while the clinic's location is easily accessible by car and train, it also comes with the downside that the clinic is surrounded by busy roads that make it so residents are unable to walk to or bike to the clinic easily from their homes. The only people that are able to easily walk or bike to the clinic are those that live in the nearby luxury apartments. And here are my references. Thank you.